Okay. Hi students. Welcome to week 4 of health promotion risk reduction. So things are flying here. So I've really enjoyed reading all your comments and all your posts on the discussion board. A couple of things. Make sure when you're doing your post on the discussion board that you're using proper APA formatting. When you're posting it on the discussion board, I don't need a title page and all of that, but I just need you to respond like with references and citations. I want you to get into the habit of learning how to do that, which is why I'm making comments about how to do that, because it's absolutely essential that you learn how to format things according to APA formatting. A couple of little things that I notice a lot of you guys are doing, not so much in the discussion board, but in the papers that you guys submitted week 2. Your running head, according to APA, when you're doing a running head, it needs to be a shortened version of the title. Some of you just repeated the exact same title. Other ones put something completely different that wasn't even associated with the title. So, and for example, like let's say my paper is gonna be communication theory in an urban setting. My running head might be communication theory or urban setting, something like that. And then running head is in sentence case, and then the actual running head is in full caps, and then the page number is flush right. So just a little things like that. Some other issues are surrounding citations, like in-text citations. So just make sure that you're looking at that. When you're doing an in-text citation, you don't use the author's initials. If there's 6 or more, you put the first author and then put at L. But the first time, let's say there's 5 authors. The first time you have to list all 5, followed by the year. The second time, if there's more than 2, you put the first author and then at L and then the year. If there are more than 7 authors on the article, the first time you cite them, you can do the first author at L. Another thing that a lot of you guys are not getting quite right is if you, like let's say that you're going to cite John Smith. So let's say that you say, according to a recent article by John Smith, then you would put the parentheses of the year, 2018. And then you would just keep going. That's sufficient. So you wouldn't say, according to a recent article by John Smith, 2018, all students need to take health promotion course, John Smith 2018. You wouldn't put that again, because that's sufficient to do John Smith and that, and then you would put the rest of it in your reference section. If you want to cite, like if you're doing direct quotes, here's another thing a lot of you guys did. Don't ever, in an APA formatting, use direct quotes, because you know how when you're talking to somebody like that, you want to highlight something, you can't do that in an APA formatted paper unless you're using a page reference. So if you want to use a direct quote from somebody, that's fine. So you could say, according to a recent study, Smith, parentheses 2018, stated, parentheses, all students should take health promotion risk reduction class, another quotation mark, and then you would put the page number, page 5. And so then your readers know that John Smith in 2018 made that statement, and I can find it, if I go to that article, I can find it on page 5. If you're paraphrasing, John Smith, 2018, suggests that all graduate students should have some form of class that talks about keeping patient populations healthy. Now I've just paraphrased it. Now I don't need the page number. So those are just a couple of little things that I see a lot of you guys doing, which is why I wanted to mention it to everybody. So that's your APA lesson for the week. So according to what we're going to learn in class, sorry about the discussion board debacle of last week. I fixed it. I think what happened is because a lot of times we transfer the courses from year to year, and I didn't, it's hard to get all of the dates exactly right, so I think I screwed that one up. So last week was, we were talking about social, cultural, environmental theories that tend to lead communities in one area of health promotion, risk reduction. This week we're going to talk about health literacy, a little bit more on culture and communication. This is such an important issue when you are talking about the health of people and reducing risk. So I will tell you, because I think I told you guys that I also have a clinical practice where this is my whole role, is to promote health and minimize risk. So oftentimes people will come in and they will hide the fact that they can't read, or they can read at very low levels. They are very good at hiding this fact. So some things that we do in healthcare, we just assume that everybody can read. So it is so common, and you guys will find this in your clinical settings, is your patient will come into the clinical setting and the front desk, the receptionist, hands them a clipboard and says, fill this out. We don't ask them if they can read. We don't, and a lot of times these patients are so savvy that they can, like if it's a checkbox, they know to just check it off. They can figure out where to sign their name, but they don't know what they're signing. And there have been a lot of reports of improper health care being provided because the patient didn't really understand what they were consenting to. They didn't understand what they were signing on these papers. So it's kind of an important issue to address. Some little things that you can watch for in your patients that might be triggers that they have some health literacy issues are if you hand them a form and then they'll say things like, oh, I can't read this, I didn't bring my readers with me, or oh, my wife usually fills these out for me. So they'll just keep making excuses. So make sure when you are talking to your patients, especially when you are doing intake interviews, getting a health history, make sure that you are also saying things like, would you like me to help you fill that form out? Would you like, is the words too small to read? So you don't want to make your patient feel bad, but you want to do some things that are going to assess, are they able to read? Maybe English isn't their first language, and maybe they can't read English at all. And so these are some things that we've got to start looking at. One, if a person can read at all. Then sometimes in our medical literature, our words are so big that people don't understand what we're talking about. Like we might say hypertension. Or hyperlipidemia, and it might be on there. Did your doctor ever tell you got hyperlipidemia? Well, no, but he did tell me to watch my cholesterol intake because I need to reduce my cholesterol. So you have to be really careful when you're talking to a patient and what the forms say. So if you ever are in a position where you're doing some patient education and things, make sure that you are using layman's terms, because you don't want to talk at such a high level with a patient. They have no idea. So you go into there and say, oh, I see here that you got hypertension. No, I don't have hypertension. Nobody ever told me I have hypertension. They might not even know that just means high blood pressure. They might not know that. So be really careful in the language and the way that you're communicating with your patients. That's key, especially when you are promoting health. And it's going to vary depending on where you are in the United States. You've got to be aware of what culture group you're talking to, what demographics that you're talking to, and really look at your forms. So when you guys are going out in the clinical setting, start looking at those forms and what are the patients expected to read, and are those words appropriate? Are they too hard? Is it acceptable for somebody who doesn't have English as their first language? So these are some really important things. You don't really think about it, especially at our level of healthcare. You don't think about that, but it's a big problem in I don't want to say big problem, but it's definitely something that as healthcare providers we need to be cognizant of. So those are a couple of things that we're going to talk about this week, and we're going to kind of focus on in our readings. And the discussion board is talk about, what did you learn about culture? What do you think about health literacy? And health literacy isn't just reading in general, it's other things like, does the patient know how to read the labels on their bottles? A lot of times those labels on their bottles are either small, or they'll have big words, or they'll use the generic name, and the patient is looking for the brand name, and so they'll get confused, or there'll be like a brand name on, well, this happens all the time. The patient will have medications at home. Let's say they're on, let's say they're on Benadryl for, an antihistamine. This is an easy one. They're on Benadryl. So then they go to the hospital for some kind of surgery. They get discharged from the hospital. They will get a discharge list of medications from the hospital, and on there it'll be listed diphenhydramine. So then they go home, and they know that this Benadryl, they're supposed to take 25 milligrams of Benadryl in the morning, and oh, here's another one of diphenhydramine, 25 milligrams, supposed to take that in the morning. So now they're taking both. Now they're getting 50 milligrams of Benadryl and diphenhydramine, which is the same drug. It's the same antihistamine drug. And then they wonder why they're sleeping and falling asleep. Maybe they're getting behind the wheel and they're falling asleep because now they've just doubled their dose. So things like that and health literacy happen all the time. So another thing that is really important in healthcare when we're promoting health is medication reconciliation. And so, like, what list is this person? What are they following? Because oftentimes your patient will come in and they have a shoebox full of pills, and maybe they can read them, maybe they don't. And sometimes they'll write on there like AM, PM, and they'll put a heart on there. It's a heart pill, but they don't know, is it for congestive heart failure? Is it for blood pressure? They don't know. So these are things that you just need to be cognizant of when you're taking care of patients, to look for things like that, to hand them their pill bottle and like, do you know what this medication is? When do you take it? And just make sure that what they're taking is consistent with what they have actually been prescribed. And as prescribers, you guys are all going to be future prescribers, you also need to be aware of that. So like, let's say you come in, your patient has hypertension, you decide to put them on a beta blocker, and you don't know that Dr. Smith down the street, the surgeon who just took out his gallbladder, noticed he has high blood pressure, put him on a different kind of medication, maybe a diuretic or something. Well, maybe that's too much. Maybe now the patient is going to get orthostatic hypotension. Maybe it's going to bottom out their blood pressure. So these kinds of things relating to health literacy and cultural competencies and things like that it's way more complex than most people think about. So, but as we go through these next couple weeks, that's the kind of stuff that I want to talk about. So this week, I want you guys to finish reading chapter 6 on social, cultural, environmental theories. It starts on page 65, and it talks about communications theories. How do people, communicate with you? And then chapter 11. Chapter 11 is important because it talks about the application of theory. So we talk about all these theories, but so what? So what? If it doesn't impact our practice, if it doesn't impact how we view healthcare, how we view our own practice, so what? So we need to kind of really talk about, okay, so this is the theory, this is the ethereal concepts that we're talking about. Let's bring it down to real life. And I just gave a couple examples with health literacy, like with some forms and with helping your patients read pill bottles and things like that. So kind of a fun week. Lots to talk about there. I want you to post again at the discussion board by Thursday. Comment on some of the thoughts that your colleagues have, and really be thoughtful in your responses. Not just like, hey, that was great, that's awesome, way to go, Charlie. Really think about, well, have you thought about this, or what would you do if that occurred? So kind of challenge each other. This is what we do in the real world. It's a dialogue of thoughts and ideas. So it's not that there's a wrong answer. It's just that You need to be versed in, I don't want to say challenging each other, but thoughtful debate, and to be able to back your ideas and back your notion with literature and with your own ideas, and you need to know what you believe and why and back it up. So it's a good skill to have. So that's one of the other things that we're doing with the discussion board, is kind of to develop those skills. So okay, so that's all I've got for this week. You guys are doing a great job. Really proud of you. I know you're super busy with all of your other work, and really that becomes your priority. I really want you to have enough time to focus on anatomy, physiology, your other courses. So this is just, I don't want to say the fluff course, because you need to know this stuff, but you know, I think it's the fun course. So where, you know, it's not as dependent on, you know, getting like there's no tests and stuff. So hopefully it's a little easier, so a little less pressure. All right, you guys call me if you need me. Keep up the good work. Really proud of you guys, and I will see you here next week for our weekly video.